Which of these describes modified shock index? Easy thing. It is something that will tell you the prognosis in a patient of shock. It's a bedside test. What you are going to do, you are going to measure the heart rate and you are going to divide it by the mean arterial pressure. Okay, you are going to divide it by the mean arterial pressure. You must know how to measure mean arterial pressure. It is going to be the pulse pressure plus 1/3 of your diastolic blood pressure. That is your mean arterial pressure. In the ICU setting, we never look at SBP and DBP in isolation, nor just pulse pressure. We always look at MAP. MAP is the average blood, the mean blood the organ is receiving per second. It is a second to second organ perfusion, right? That's why you always look at mean arterial pressure and not SBP or DBP in isolation. They are better markers. So if the modified shock index, which is going to be heart rate divided by MAP. So you think of it like this, heart rate upon mean arterial pressure. How much should the heart rate be in a normal person? It should be like 70. How much should be the mean arterial pressure in a normal person? It should be something like 70, 80, 60, 70. So in most of us, the shock or the modified shock index should be less than 1, approximately. If my heart rate is increasing too much, because that's what happens when I'm having shock, and my mean arterial pressure falls, the modified shock index will become more than 1, which is a dangerous thing. So there are two indices. One is a shock index, and the question asked about modified shock index. Modified shock index is heart rate upon MAP, which is a better marker, and a decline in this modified shock index is associated with a poor prognosis, right? If it declines, it is associated with a poor prognosis. It is telling me about hypoperfusion, right? So if it increases, it means the person is having hypoperfusion. A normal should be less than 1. Up to 1.3 is okay. If it is more than 1.3, it is a poor outcome. Right? It means heart rate is too much and the MAP is too little as a fraction. Earlier, they used to use shock index, that was heart rate upon SBP. I told you SBP is not the best marker of organ perfusion. Mean arterial pressure is better. And there they would say if it is more than 0.9, it has a high mortality risk. But between the two, modified shock index, anything which is modified is going to be more valuable. That's why they came up with the modification, right?